This is my informative speech. Lyme's disease is an infectious disease caused by bacteria that is transmitted from the bite of an infected tick. The disease is named after Lyme, Connecticut. It was first diagnosed in 1975 when a group of kids were diagnosed with rheumatoid arthritis. According to the Department of State Health of Texas, 1,682 cases of Lyme's disease was reported from 1990 to 1998. One of those cases was my mother. Lyme's disease has been reported in all 50 states, including China, Europe, Japan, Australia, and also parts of the Soviet Union. Here are some of the signs to look for in the Lyme's disease if you think you might have been infected. When the bacteria spreads in the skin, the infection causes a reddish rash that is associated with flu-like symptoms after the bite of the infected tick. Fever, headache, stiff neck, fatigue, and muscle and joint aches is all flu-like symptoms after being bitten by an infected tick. Severe abnormalities result in weeks, months, or years after the acute illness. Neurological, rheumatological, cardiac complications can occur in the later stage of the disease. Lyme's disease is mostly associated with tick exposure, but there has been some cases where it has been linked to a flea also. There are more than 800 different types of ticks, but few feed on humans. They will feed on humans of all ages, ranging from young children to adults. It is important that you examine yourself if you are in the area that are tick habitat. Use tweezers if possible to remove them, and it is important to remove these ticks so there is no transmission of the disease if the tick is infected. There are 3 different stages of the Lyme's disease. The early localized disease stage, which is inflammation of the skin. This is where the red rash occurs. The early part of the disease is heart and nervous system problems, which can include meningitis. The late part of the disease is motor and sensory nerve damage and also brain inflammation. As the Lyme disease progresses, it can result in abnormal heart rhythms and heart failure, Bell's palsy. It can also cause anxiety and depression in some cases, according to the Lyme Disease Association. How do the doctors make the diagnosis? In the early stages, it can be simply diagnosed by the red rash or blood testing for the Lyme's antibodies, usually not necessary in the early stages though. Usually you can find it just by looking for the red rash. These antibodies can be detected in the blood test with the method called enzyme-linked immune absorbent assay. Here are some of the treatments that they give for the Lyme's disease. Most of the Lyme's disease are curable with antibiotics. The type of antibiotic depends on the stage of the Lyme's disease. Early stages are usually with antibiotics such as doxycycline, amoxicillin, or ciprofloxacin. A later stage in the Lyme disease, which is the nervous system damage, requires intravenous drugs like Rocephin. This is the same treatment my mother received when she was diagnosed with the Lyme's disease. It is a bacterial disease caused by a bite from an infected tick. It can affect the joint, heart, nervous system, and even the heart failure. There are 3 stages to the Lyme's disease. Lyme's disease is based on the diagnosis and the signs they are showing.